Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Somatoform disorder. Somatoform disorder, let's look at some important somatoform disorders. First, we start with the somatic symptom disorder. So, somatic symptom disorder. So, somatic symptom disorder, the key features of this is that there is excessive anxiety. So, there is increase in the anxiety and there is preoccupation with greater than equal to unexplained symptoms. So, there is preoccupation. There is preoccupation with greater than equal to 1 unexplained symptom. Unexplained symptom. Next is illness anxiety disorder. Illness anxiety disorder. So, illness anxiety disorder, this is the hypochondrias. Hypochondrias. And this is the fear of having serious illness despite few or no symptoms. So, it is a fear of having the illness, fear of the having illness, and despite few or no symptoms and consistently negative evaluations. So, you have a negative evaluations or you have no symptoms. Next is we look at the conversion disorder. So, what is this conversion disorder? So, conversion disorder, it is nothing but the functional neurologic symptom disorder. So, functional neurologic symptom disorder, and this will be the neurological symptom incompatible. So, it will be the neurologic symptom incompatible and with any neurological disease. This is with any neurologic disease, and often the acute onset associated with stress, and it is associated with the stress. Next is the factitious disorders. So, this is the intentional falsification. It is the intentional falsification. So, intentional falsification, or there is an inducement of the symptom. There is inducement of the symptom, and this is with the goal to assume the sick role. So, it is with the goal to assume the sick role. Next is we move on to malingering. Malingering is a falsification or exaggeration of the symptoms. It's a falsification or the exaggeration of the symptoms, and symptoms to obtain the external incentives. So, symptoms to obtain external incentives, and this will be known as the secondary gain. To learn and grow daily like this, please do subscribe.